So I thought I would do this video on diabetes. And so the sign it's a two-part sign. So this is sugar or sweet, that concept. And then the D hand shape, shaking back and forth, is diabetes. So the sugar diabetes is basically what you're saying. I had a colleague that a patient just did this, trying to tell the doctor that they had diabetes. And so the interpreter says, "Oh, doctor, you're so sweet," because she was looking at the doctor. And he goes, "Oh, thanks." But as it came about that she was trying to tell him that she had diabetes, so she had just kind of cut the sign in half. I've also seen the opposite where they've just done this diabetes. But sugar diabetes, my grandmother, my mother used to say that together, sugar diabetes, and it's more clear. And that's the whole point, is that you want to be clear because you're not really sure if they're saying something else. So if you put it together for diabetes. So sugar diabetes. So if you just want to remember that in your brain, sugar diabetes, that's what you're basically saying. And so diabetes has become, or is, well, I say becoming, but they're noticing now more that people's health issues is because of diabetes or too much sugar in their system. They're noticing that high blood pressure, you just do the H hand shape and you go up high blood pressure, and this is the cuff, blood pressure. And the new fatty liver disease, which normally a long time ago it was only if you were an alcoholic. I didn't do a drunk because it's an alcoholic. It's a little bit different connotation there. So, but now it's non-alcoholic fatty liver disease. And they're now realizing that it's not just because you're eating fat, you're eating too much sugar. Not every doctor is recognizing that, but there's many doctors that have been able to research that there's too much sugar in our diet and what we're eating. So not diet because we're trying to control our weight, but what we're eating. So if you don't want to say our diet, what's your diet like, I would say, because I'm thinking, oh, I'm not on a diet or I'm trying to diet, I would ask your friend, what are they eating? So let's have this conversation. So your friend went to the doctor, and you can ask, oh, so what did the doctor say? Well, they said I had diabetes. Really? What is your A1C? A1C. What is your A1C? Oh, it's 7. Well, I think if it's 6 or below, it's non-diabetic, and if it's above that, then they are, I think 6 is borderline or whatever, and then above that is diabetic. Oh, I'm so sorry. You could say, poor you, right? I'm so sorry about that. But I would say, oh, I'm so sorry. So what did the doctor say? Well, they said I needed to change what I eat. And they may say diet, but it's really not on a diet, what we think of as a diet, but it's changing what you eat. So there's two ways to use that word diet. What is your diet like? Not that you're on a diet, but you do try to control what? The carbs. And I always spell it. And so they have to learn to read the labels on all the food. On the bag they have the labels, and it shows how many carbs. And then they'll say and it'll say it in grams or milligrams, and then they'll say how much sugar is in there and how many grams are in your food. So you need to be careful, okay, hand shapes, careful, and control that, or lessen how much sugar and how much carbs are in your food that you eat. And so then you can talk about that. So they say that frozen vegetables may be better than canned because they'll add salt and sugar into the canned food. or you can get fresh. This is new where you're scooping, think about it as dirt or something, and you're scooping dirt off, and then you have that new dirt, right? So anything that you're scooping is new that's underneath there, scooping off the old. So in the same concept, we use fresh. So F hand shape, fresh. It's still new, so fresh vegetables. That's the best because there's not any added. They may have used some, I would say bug spray, because pesticides, you could say they use that bug spray, so you have to wash your vegetables and your fruit, but it's better to get fresh or frozen, but you don't want processed food. What's processed food? Processed food is when they add all those preservatives, all those chemicals, and they add salt and they add sugar, so you'll eat it because it'll taste better. So there's all these different additives in our food now that's causing us to become sick. So we think, oh, we're eating healthy, but if it's been processed, then it's not as good for us. And I would say nutritious. And as an interpreter, I might have said I would have voiced nutritious, but for a deaf person, there's not really a sign for nutrition. I say nutrition like restaurant. I say nutrition, the nutritionist. But I'd say food good for you. And why? It's not because they're simple-minded, but because the language, it's more clear. And that is the point for everyone to communicate. You want it more clear. So make sure that you use the right concept. Don't be concerned about your English words, but more about the concepts. And the work of an interpreter does that. So they would have to stop drinking Coke. I did soda pop, like you pop the top of the can. Soda pop. That's universal. I say Coke for everything, even a 7-Up or a ginger ale. So you could do Coke, but this is the sign for Coke. This is the old-fashioned for the original cocaine sign. And so some people will say they're talking about the brand Coke, and sometimes it's just a soft drink. So the sign for cocaine as a recreational drug is use this for on the nose, the thumb on the nose, because you're sniffing it in. This is the original one, but this is not used for cocaine. It's used for Coca-Cola or Coke. But this is kind of a universal of a soft drink. So when you need to drink soft drinks, that's too much sugar. Oh, Gatorade. Gatorade, did I spell that right? Yeah, but look at the label. It has how much sugar in it? Oh, yeah, you're right. Ooh, what should I drink? What about tea? Well, do you add sugar? Well, of course. No. So what you should drink is what? Water, right? And then you can add that, the flavor that you just squirt in, and they have it with the monk fruit, M-O-N-K, monk fruit, that is healthy and it doesn't add to your sugar level. Now, I would have normally voiced glucose, and so if you hear the word glucose, it's sugar level in your blood. And so it's always good to know that so you can sign it clearly. So now after you have a discussion about what types of food have a lot of sugar in it, make sure you read the labels and you look at the sugar, how much, and then how much carbs. And your doctor will send you to a nutritionist, and they can explain and discuss how many carbs you should have for each time you eat, or for a total of the day. And sometimes they'll divide it that way to make it easier for people to read it, because it's harder to change how you eat, like bread and pasta. Oh my. So, I love that, but you can be careful of the salt, because you can change into real butter, but the no salted. And then if you want to add salt to your food, then you're controlling, or you can see how much salt, instead of foods that have added a bunch of salt, and then you add salt, so it'll taste better, salt and pepper to taste better, and so now you have too much salt. And I know that doesn't have to do with diabetes, but it has to do with inflammation inside of your body. So anyway, so let's get back to the diabetes and let's discuss the medications. Now, the first medication that most doctors will give a patient is metformin. Now, there is no sign for medications. You can say the metformin, and they'll kind of spell the first few letters, and sometimes they know the name of it, but most of the time they're like us. They're going, oh, it starts with an M, M-E, blah, 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 metformin. But you could also say anti-diabetes medication, and so that helps. And that's what I do for blood pressure. It's like, it's the blood pressure medication. Oh, okay. Yeah, I'm taking that. They don't know the name of the medicine, but they'll know the type of medicine that they use. So you can say your diabetic medicine, or are you still taking it? Oh, yes, every day, or however frequently they're supposed to. So that's the first medication. Now, sometimes they'll add it or increase. Remember when we said increase the dosage? Dosage, you could spell it, but I would say milligrams, or they increase the grams, because that's how they do that. So they increase that a little bit. They'll increase. Or then they maybe add a different type of diabetic medication. Then if they have to use insulin, then that's the one that it's the pen, and you click it and you hit your thigh with it. That's what or sometimes their abdomen. But that is the sign for these insulin medications, because that's how it's used, as a pen. You don't have to do the IV and the whole shot thing anymore. You can just do the pen, which is a lot easier. So you do this and do this, and they have to. They can look on there, but sometimes if they have to increase how much they're using, then they turn that little dial. So on the insulin or the insulin medication, either one, if it's here or here, and I think they have to change where they put that medication. Then you say, oh, and they increase, how much you have, increase it to like 40. Now it's 45, whatever. To that. So they have these numbers on that little dial, and they can increase it themselves whenever they go to the doctor, and the doctor tells them, we'll increase it. Instead of 30, now have 40, or whatever they say, because it depends on their A1C number, and that is taken every 3 months, but since it's multiple, it's more than one. See, this is month, but if I'm going to say months, then, and it's 3 months, I'm going to do 3 months. I'm going to do twice, because that's the S. That's the multiple on it. And so those medications, you would spell it out. But, and sometimes it's important, because sometimes the patient is using 2 different medications. For example, I had to write them down because to spell them. Like the Ozempic. And they'll know, because it's OZ, they'll know that one because it's easy. And then they may be taking like the Mounjaro or the Jardance. So they'll have the different kinds. There was another one that I thought that patients, Trulicity, that they'll take. And those are the most popular ones that I'm seeing. And so they may, and I had a couple of patients that used both the Ozempic and the Trulicity. And sometimes they had a different kind. So I think it started with an L. I was going to look at that. But anyway, the Lantus or something like that. But anyway, So they'll know the names, if not a complete spelling, a partial spelling, because sometimes they'll say, I want you to take the Ozempic, say a number 20, and then I want you to do the Trulicity 30. So they have to kind of look at that. And the doctors have it written down and they print it out at the end of their appointment. They hand it to them so they know what to use, especially if they're changing their medication. But that insulin is either in the abdomen or on the thigh, and that is the sign for that, not a specific brand name. You would have to spell that. So that's one thing about medical, is most things are spelled on medication and things like that. So the fatty liver disease is spelled, but you can say the liver. And they'll say, well, why the liver? Because it can't disperse or release, I think, the sugar or the whatever cells. And so it does affect your sugar levels and your blood pressure. I know those two, that it affects that. And so that's why so many people are now having this fatty liver disease and diabetes, is because of so much sugar in our diet. The things that we eat is added into there. So many carbs and so much sugar. And they'll separate it out, but it'll say total carbs, but it'll say carbs, sugar, and total carbs. So you have to look at that label and find out what is best to eat during the day, and maybe kind of cut back or eliminate those things that you eat. Anyway, so I hope this is a good discussion for your family and your friends, because they are noticing that children are now getting what was before referred to as adult onset diabetes. They notice that children are getting that now, and I know it's the process of too much sugar in the food. So anyway, y'all have a good one, and I will see you later. Bye.